Good morning, guys. This is Dr. Diane Settles,
Physician Assistant Leslie Elliott.
We're here in our new gastrointestinal practice treatment room to talk to you about colon cancer screening and prevention.
So colon cancer is the most common gastrointestinal cancer. It is the third most common cause of cancer death in the United States, with over 100,000 cases diagnosed every year. And so that is basically cancer of the large intestine or of the bowel.
And I think the most important thing to know is that this is either a preventable cancer or a cancer that is if detected at an early time, is completely treatable. We know tobacco in general is a risk factor for almost any type of cancer, particularly all gastrointestinal cancers, whether it be esophageal or pancreas. But it is definitively an increased risk factor for colon cancer. It also, we note more polyps in individuals who are tobacco abusers. And polyps are precancerous lesions that increase your risk of developing colon cancer. In addition, another thing that people often think about is alcohol. So tobacco and alcohol often go hand in hand, and both of those do increase your risk of colon cancer pretty significantly.
So yes, the age has actually changed from age 50 to age 45 now is the recommended age to start screening. And this is typically covered as a preventative measure on your insurance. There are multiple options for colon cancer screening. Of course, direct visualization with colonoscopy is still the gold standard, but there's also FIT testing, Cologuard, which is a stool DNA testing.
I think it's also very important that people recognize the limitations of testing. So oftentimes when we talk about colon cancer screening, we're talking about average risk. And people may say, what is average risk screening? Average risk means you have no symptoms and you have no family history. So that's a discussion that you should have with either your primary care physician, a surgeon, or a gastroenterologist regarding what is the most appropriate testing for you. Cologuard has become very popular because it's very convenient, but it's also very important to know that that is for average risk. So for people who've had a history of colon polyps or a family history of colon cancer, that may not be the best modality for them. And physicians can help direct patients to the benefits and risk of all modalities. Now, there are some populations of patients that will need to start colon cancer screening earlier, depending upon family history or additional risk factors. And that's why it's very important to have a discussion with your physician if you have any questions about getting colon cancer screening and when that should start. HPV vaccine is a real big buzzword now because we know HPV is associated with lots of different types of cancers. Head and neck cancer, esophageal cancer, anal cancer. HPV has been detected in some colon cancers. So the answer is we're not sure yet. We highly recommend the HPV vaccine. The other interesting thing is that previously we used to say HPV vaccine was 9 to 26 years of age. And now within the last several years, they've increased that to 45. And the reason they've increased that to 45 is because it is associated with preventing multiple types of cancers. And a lot of these cancers it prevents are very devastating cancers.
So that would be a good time also to have that conversation, as a primary care provider as well, that if you're talking to your patient who's 45 about having a colon cancer screening, to also get the HPV vaccine at that time.
Of course, exercise and diet are important in all aspects of health. Studies have shown that exercise does decrease colon cancer risk. Now the question is whether that's actually truly exercise itself decreases colon cancer risk, or that you're having a healthier lifestyle. Definitively food. As clean as you can eat is going to be your best option. So lots of fruits and vegetables and fiber and decreased processed meat and red meat. There has definitely been association. Also obesity. Unfortunately as a country we have become an obese nation, and we definitely know that obesity is associated with colon cancer. So exercise and diet are going to be very important in treating obesity and decreasing your risk.